Hi, I am Dr. Dominic Pelle. I am a surgeon in the Neurological Institute at the Cleveland Clinic. I am a director of Center for Spine and Pain Management and a spine surgeon. What is minimally invasive spinal fusion? So spine fusion surgery is a surgery that is utilized to help to ameliorate pain and improve stability of that spinal segment. So minimally invasive spine fusions, or as we call them, MIS fusions, utilizes techniques that allow us to fuse and decompress the spine using smaller incisions. So a wonderful way to think about this is minimal access surgery. So it still allows us to perform the fusion of two bones together, such as if we're doing an L4, L5 fusion, fusing those two bones together, but instead of doing large open surgery, we can do those through smaller and smaller incisions with a variety of different techniques. What conditions can minimally invasive spinal fusion treat? Typically, what we're trying to help is pain, pain and dysfunction, and the dysfunction that results from pain. And so what we're trying to do with spine fusion procedures is we're trying to take abnormal movement of the spine and stop it from occurring. And that oftentimes will help to improve pain. Asymmetric collapse and degenerative disc disease can be a reason to have a spinal fusion. Spinal stenosis, especially associated with instability. Foraminal stenosis, associated with foraminal height collapse. Spondylolisthesis and degenerative scoliosis are some of the most common reasons we perform spinal fusions. What are the common types of minimally invasive spinal fusion? When we fuse the spine, we think about how we access the spine. And so we can access the spine through the front of the body, where it would be an anterior fusion. We can access the spine through the side of the body, which is in the same component of the abdomen as through the front, but we just position the patient on the side, and we could usually do it through a much smaller incision. There is a muscle that lies along the side of the spine called the psoas muscle. If we go right through that muscle, we call that a direct lateral fusion. If we come right in front of that muscle, we call that an anterior to psoas fusion, or in front of the psoas. You might hear it as an oblique lateral fusion or an OLIF surgery. If we come from the back of the spine and we fuse through the disc space through the back, we would call that a minimally invasive transforaminal lumbar interbody fusion, or MIS TLIF. So those are the most common minimally invasive fusions that we perform. What does recovery look like after minimally invasive spinal fusion? So after a minimally invasive spine surgery, especially a lateral-based spine surgery, typically you are in the hospital at least overnight. There's sometimes you can go home the very next day. We like to get you up and moving the day after surgery, so we would like to see you walking the halls the day after surgery. We wait to discharge you home until we have return of bowel function, because we're going through the abdomen, so we want to make sure that everything is moving and working as it should after surgery. In the first couple of weeks, there'll be some soreness associated with the surgery itself, but you can walk as much as you'd like to walk, as much as you feel comfortable walking. We would like you to avoid doing any significant heavy lifting. So a great rule of thumb is it weighs more than a gallon of milk, you probably shouldn't lift it up. If it's on the floor, you probably shouldn't pick it up. You're going to bend a little bit, you're going to lift a little bit, you're going to twist a little bit. That's okay. We just want very thoughtful movements. At 6 weeks, we get x-rays to make sure that everything looks good from what we put in. We want to make sure that you're feeling good. At that time, we'll start you in regular physical therapy, and we'll begin to release restrictions. And from 6 weeks to 3 months, I would like you to slowly get back to your normal activity level, with the goal of reaching sort of whatever normal activity looks like for you at 3 months. And everybody takes different times to recover. So what I always tell patients is, if that train is moving in the direction of a destination we want to go to, we just keep riding it.